How easy is it for you to handle these monkeys? Is it like handling a pet dog or a cat?
No, it's not. They are non-domesticated animals, which means that you could take them out. They're about 10 kilos, so it's sort of the size of a small dog, really. You could take them out, but it would be very stressful. Which is why actually the observation plays a very critical part, and skilled animal technicians and skilled researchers spotting things very early is crucial. It's rather like an owner often noticing that a dog may just be a bit more quiet or withdrawn, and as a vet actually you can't yet see anything obviously wrong with them.
What kind of health problems do monkeys have in research facilities like this?
Quite apart from the physical health, the psychological well-being, particularly of the primates, is crucially important, and one way to ensure that that is maintained is keeping them in social groups. But monkeys being monkeys, they have got a very strict hierarchical structure, but it is subject to change. So as animals grow and develop, the social structure will change as well. And part of that is that they will have fights, and they can have cuts and bruises, and the medications we would use is really quite similar to what you would know from your dog or cat.
Many of the monkeys here have got head posts. What are these for?
The posts particularly are used for restraint. So the idea is that during many of these procedures, such as imaging, the animal's head needs to be really still. There are other devices which have a different purpose. They may look quite similar, and the technique to apply them is very similar, but they're used to advance electrodes. For instance, electrodes are used to actually measure the neural activity. So that's quite different because they go inside the brain rather than the head post, which is just attached to the skull.
How are these posts, these cranial implants, attached to the monkey's skull?
They are orthopedic devices, so that could be titanium, could be bone cement, standard material that we use. And in the case of the head posts, they're literally screwed into place. Very similar, you can compare it to repairing a fracture. So the screws are drilled into the skull to just maintain the security, and it's very safe to do that.
Who actually attaches these posts? Who does the surgery?
So the surgery is actually conducted by the researchers. There is a regulatory requirement set out by the Home Office that every researcher needs to have training. Now the training is actually very complex. It's courses that involve lectures and practical sessions and hands-on sessions, and the vets are very closely involved in the training, in fact deliver all of the training to do with the surgery, with the anesthesia, with care for the animals.
Doesn't it hurt the monkey having these posts attached, these surgical implants put in?
So there is no doubt that any surgery has the potential to hurt, and as such you would get painkillers, and that's exactly what the animals will receive as well. They're being monitored several times a day. If needed, people stay with them overnight if there's any concern, and that covers the immediate post-operative period. However, once that's over, the implants are really very similar to having other orthopedic repairs, such as having an artificial hip or a knee, and as such, it's thought that actually the wearing an implant itself doesn't hurt.
How do you ensure the monkeys are content, as much as we can understand what it is to be content if you're a monkey?
That's a really good question. This is where the psychological assessment of psychological health comes in, and that can be really difficult. One method that is used in the behavior assessment of these animals is using lightweight devices. What it does is it helps to assess the animal's activity and behavior, not just during the day where we are there and we can see them anyway and we monitor them, but also at night. We are spending pretty much all day with them, but you don't know how much an individual animal spends engaging in foraging, for instance, or in grooming, or in social interactions, in resting, or being very active. And it allows us to look in far more detail about how to find an optimal social structure within a group, but actually within a room. I'm able to dedicate, apart from my day-to-day veterinary care, looking after the well-being of these animals and helping refine procedures, is dedicate time to assess the animal's well-being in this environment, and sharing this finding openly with other researchers and the entire research community, not just in this country but internationally. Collaborations are crucial, and being able to visit other places and them to visit us, and sharing what works and maybe what doesn't work so well and can be improved is crucial to keep things moving forward. And I think we're very privileged to be able to embed that sort of welfare research whilst these animals are engaged in their normal research activities in neuroscience, because it's got to go hand in hand to assess how the animals are really, how the animal's well-being is in this situation.